This is Dr. Arun Vishnar, and today I will be talking about hypertension and its relation with gastroesophageal reflux disease and acid dyspepsia. Now, this gastroesophageal reflux disease and acid dyspepsia is very common. What I have seen in clinical practice that patients who come to me with history which is suggestive of gastroesophageal reflux disease, acid dyspepsia, their blood pressure is raised. And as soon this acid dyspepsia is controlled, the blood pressure goes down by itself. So it is very necessary, it is a must to measure blood pressure properly in a patient of acid dyspepsia and gastroesophageal reflux disease. It is seen that in many studies also it has been seen that in patients with hiatus hernia, where there is gastroesophageal reflux, it precipitates hypertension. And as soon with the help of proton pump inhibitors and prokinetic agents, when this gastroesophageal reflux phenomena is controlled, blood pressure goes down by itself without use of any antihypertensive drugs. In cases of gastroesophageal reflux disease, in cases of hiatus hernia, it is usually seen that asthma is precipitated. This is again one of the cause which can precipitate hypertension. Idiopathic pulmonary fibrosis, again, this can lead to hypertension. So these are all sequelae of gastroesophageal reflux disease. So if patient is having gastroesophageal reflux disease due to any cause, whether it is because of obesity, it is because of hiatus hernia, it is because of pregnancy, it is because of use of chocolates in the diet, use of excessive cheese in the diet, anything which is precipitating this gastroesophageal reflux disease, it should be treated first and then measure blood pressure. In many cases, it is definitely the blood pressure will come down to normal without use of any antihypertensive drug. And if still blood pressure is raised after control of this gastroesophageal reflux phenomena, still if BP is raised, then in that case you can use antihypertensive drugs. Now, antihypertensive drugs which you will use, every antihypertensive drug will cause laxation of the esophageal sphincter, lower esophageal sphincter. That particular area will become lax because of antihypertensive therapy. So these patients who are on antihypertensive therapy, they also develop gastroesophageal reflux disease. So this is again a vicious cycle. If you are giving antihypertensive drug to hypertensives, they will develop gastroesophageal reflux disease. And if patient is with gastroesophageal reflux disease is there, he can develop hypertension. So this is a vicious cycle. So by clinical examination and your intelligence, you will have to decide that whether it is a case of gastroesophageal reflux disease or it is a case of hypertension. Similarly, in cases of acid dyspepsia, any type of acid dyspepsia, whether it is because of proximal gastric distension or it is because of distal gastric distension, it is because of H. pylori infection, it is because of smoking, excessive use of spicy food, excessive use of tea, any such condition which is causing acid dyspepsia, again it can lead to hypertension. In many studies it has been shown that acid dyspepsia leads to hypertension. So whenever a patient comes to you with acid dyspepsia, you should always go for thorough examination of blood pressure and try to normalize that blood pressure without using antihypertensive drugs. And if still it is not controlled, then in that case you can give antihypertensive medications. So whenever a patient comes to you with such type of problem of burning sensation in epigastrium, reflux phenomena, and if suppose he is complaining of severe headache or he is complaining of uh, some unusual type of sensation which he cannot describe, then always rule out hypertension. In many cases of hiatus hernia, in many cases of gastroesophageal reflux disease, in many cases of acid dyspepsia, patient they develop sleep apnea syndrome, and again in sleep apnea syndrome patient can develop hypertension. So never label a patient as a case of essential hypertension without ruling out the cause of other cause which is other cause like gastroesophageal reflux disease or acid dyspepsia which leads to hypertension. Intelligently, you will have to decide whether it is hypertension or it is because of acid dyspepsia. In many cases, it has been seen that when you give proton pump inhibitors in night during night time at 9 p.m. or 10 p.m., then blood pressure is controlled, well maintained during night hours, during sleep. And sometimes with the help of only proton pump inhibitors, it is seen that hypertension is under control. So it is a matter of proper physical examination. It is a matter of proper intelligence of a doctor to decide whether the hypertension is because of acid dyspepsia, because of gastroesophageal reflux disease, or gastroesophageal reflux disease and acid dyspepsia is because of antihypertensive treatment. So you will have to thoroughly examine, you will have to do proper follow-up, you have to properly interrogate with patient, you have to do proper, you will have to ask proper questions about the lifestyle of that particular patient. So like this, with the help of proper workup, with the help of proper thorough investigations, you can decide about whether it is hypertension is causing acid dyspepsia in GRD or GRD is causing hypertension. So you will have to break up this vicious cycle and you can cure many of the patients. Thank you.